You are building yourself from the scratch. Right now we
Correct.
have some SOPs designed for us. We have to just indulge ourselves into it and get work
But
started.
no one was watching us. I tell you one thing. Even if we made a mistake, no, I don't think we made a very major mistake, but yes, mistake did occur. So देखा होगा आपने कि एक गोरे कपल का black baby हो गया और mixing, semen का mixing. Many times, you know, the strippers were being or a mouth pipetting was used for multiple patients. So one embryo could land up from one plate to another plate. Or the semen straws could get mixed, but now this thing cannot occur. This thing is not acceptable now. So even if mistake occurred, I think it didn't occur with me, but a lot of articles were in the newspaper. You're finding mix up ho gaya, the color change.
Yeah.
But nowadays you don't hear about them. These things they don't occur because you got something called a witnessing system. You got multiple embryologists, multiple technicians. Then things have become much better for this generation. But they are under very tough scrutiny, and law is watching them at all the times. I mean, you fill in so many forms every day for every patient. At our times, we only had one small register, which we used to fill with the hand, and that was the only one we had. But you guys have to fill in around 8 to 9 forms every day. And the more difficult, I'm now working with the corporates, I've realized that doing an embryology is so simple, but filling those forms is the most difficult part. And every day when I get the feedback from my units all over the country, and I follow every egg, I follow every fertilization failure, I follow every egg which got denuded and gave me a GV. So now we are putting them under different sort of a stress. No one ever inquired what happened to our eggs.
Yes.
Get this point? हमारे पास पानी नहीं होता था. So we used to go to battery shop, get water, boil it and use in our incubators. That's the only thing we had. We didn't have any IVF grade water at our time. Our whole work was being done by 70% alcohol. And now when I teach people, I say no alcohol.
No alcohol.
Alcohol not allowed. Those simple battery waters not allowed.
Not allowed.
But things are actually changing. I remember some time back, a woman clinician could enter the lab holding her purse and क्या हो रहा है दिखाओ मेरे को, how the baby is made, how the embryos. But nowadays you just don't allow, I think, any embryologist to look at yourself. You'll never wear any lip gloss, no nail paints, no perfumes. And as a male, I've never applied any deodorant. I think I left deodorants and perfumes around 20 years back. Soap has to be something very mild soap. Nails have to be properly clipped up. So that's a different discipline we have. And I think the message for everyone is that embryology looks very lucrative, but it entails a big amount of sacrifice.
Sacrifice is there.
और embryology में क्या होता है? You either pass or you fail. You know, when we do a surgery as a gynecologist and we find कि हमने surgery करा, थोड़ा scar अच्छा रहा, बुरा रहा, और surgical outcome can go, some complication can occur, that can be repaired, that can be done with. But in embryology, one breath and it goes. I have seen people when we're working and you're trying to do stripping and the stripper falls out. It falls with embryos in it. What do we do? You're working and the plate moves and the drop spills and embryo goes in some other well. What do you do? So I think हमें अब पूरी जिंदगी के अंदर एक तरह का ना एक बहुत ठहराव लाना पड़ता है. लाइफ को रोकना पड़ता है. That excitement, we have to control our excitement, control our ambitions, and we have to just settle down for this particular job. और अगर आप देखें ना शिल्पा, एक कपल को आपके पास पहुंचने के लिए और मेरे पास आने के लिए it takes minimum 5 to 6 months. तो 5 से 6 महीने का समय लगता है उनको to decide that they have to go in for an IVF. Even IUI is under our prerogative. वो 5-6 महीने के बाद में they reach us. This means that 5-6 महीने के अंदर they do around 8-10 visits to a doctor. I'm sure you'll agree to this. And every visit is around, say, minimum 2 hours, because it's not about just seeing them for 10 minutes, but they take time. And then some medication, some ultrasounds. They spend around 40-50 hours before they reach the OT. And OT, Jack Robinson, you give them some propofol, ketamine, and within 15 minutes maximum, the eggs are in front of you as an embryologist. And then they are under a workstation, looking at them under a microscope, and then the journey starts. So looking at those, egg collection will take maximum of 15 minutes for a doctor. But for you, it may take around another 5 or 6 minutes. Denudation may take around another 5 or 6 minutes.
True.
ICSI take around 10 minutes for a good
Yeah.
ICSI embryologist. So I think within 1 hour, we can close our embryology work. In case we're working with multiple patients, I think 1 to 2 hours is all embryology work which we do for a regular patient. But the key lies with you. एक छोटी सी गलती कर दी, the whole labor of around 6-7 months goes off. I think जो सपने हैं ना, जो हम as a gynecologist what we do, we are trying to create एक मिट्टी का एक छोटा सा बेबी, उसमें जान आप लोग डालते हैं, जान एम्ब्रियोलॉजिस्ट डालता है, उसके अंदर एक आत्मा आप लोग डालते हैं. There comes the role of spirituality. I think there are so many articles when we were young, और अभी भी when I do any embryo transfer, I give them a menu card. क्या सुनेंगे आप? 93.4 FM, you want to listen to some Gurugram, you want to listen to some, she may be from different religion, and they all want to listen to some soothing music from their religion. So we have to have a la carte menu. We play their favorite song which they want to hear. So they are relaxed. I think spirituality has got a very big role to play. I think doing some sort of healing for them, doing counseling for them, because it is not about surgery, it's about how she's feeling at that particular time when you're doing an embryo transfer. How much time do you take for an embryo transfer? Less than 1 minute. So in 1 minute on one side and around 70-80 hours on one side, 1 minute or less than 1 minute की गलती के कारण से she may lose a pregnancy. Last effort of an embryologist loading an embryo can cause a problem. कुछ हुआ तो पूरा साइकिल खराब हो गया. Her moving to the lab and giving me a catheter or my doing it myself and just pushing it takes barely less than few seconds. And it goes, and then I say 1, 2, 3, 4, 5, rotate, out. And then there's a beta SHG. हम नहीं कह सकते शिल्पा कि हमने बहुत मेहनत करी. We cannot say कि we work very hard. We cannot say हम बहुत अच्छे डॉक्टर हैं. आपका result is like a score sheet, is pass or fail. So I think every young embryologist should understand that they cannot say that they're hardworking. They have to be performing effectively. Efficiently is not required by the patient. आप बोलेंगे हमने तो बहुत मेहनत करी, वो बोलेगा मेरा तो रिजल्ट नेगेटिव आया. So it's not only working efficiently, it is working effectively and ethically.